Medication errors aren't accepted because hospitals are busy. Patient falls aren't accepted because staffing is short. Why is predictable worker harm treated differently? Healthcare has transformed patient safety by asking one question: what in the system allowed this to happen? When predictable patient harm occurs, organizations investigate, redesign, improve, and expect safer outcomes. Yet repeated harm to healthcare workers often follows a different path, even when the risk is well understood. This video explores why. Not through blame, but by examining how organizations gradually adapt to predictable harm. Consider one nurse's story. She suffered 2 broken ribs after being assaulted twice by the same resident in less than 2 months. Everyone recognized the danger. The resident needed specialized psychiatric care, but no bed was available. Staff were told they would continue caring for the resident until a transfer became possible. The explanation from leadership was simple: that's just how it is. Those 5 words weren't intended to excuse the violence. They reflected a system with no immediate solution. That distinction matters. This is not a story about uncaring leaders. It is a story about organizations under sustained pressure. Good people can make reasonable decisions while working within systems that offer few acceptable options. Over time, temporary compromises can quietly become accepted operating conditions. Healthcare has seen this before. Predictable patient harm led to systems thinking instead of accepting injuries as inevitable. The same question deserves to be asked about healthcare workers. When harm becomes predictable, what should happen next? Too often, the system adapts to the risk instead of redesigning the conditions that continue exposing staff. This adaptation shift rarely happens through a single decision. It develops gradually through hundreds of reasonable responses to difficult situations. Eventually, the conversation changes. Instead of asking, how do we remove the hazard? It becomes, how do we keep operating despite it? As organizations adapt, expectations begin to change. Staff stop asking, why is this still happening? And begin asking, how do we work safely within it? Language changes too. We're waiting for placement. Resources are limited. That's just how it is. These describe reality, but they can also redefine it. Over time, repeated explanations become repeated expectations. Temporary circumstances begin feeling permanent. The organization hasn't written a new policy, yet predictable worker harm has quietly become part of normal operations. This is organizational acceptance of predictable harm. Not because anyone intended it, but because adaptation gradually replaced redesign. This doesn't mean workplace violence can be eliminated. Some patients will remain aggressive despite excellent care and appropriate treatment. Healthcare will always involve some occupational risk. The goal isn't 0 incidents. The goal is fewer predictable injuries. Patient safety improved when healthcare stopped asking who made the mistake and started asking what in the system needed to change. The same systems thinking can be applied to workplace safety. Not to remove every risk, but to reduce foreseeable harm wherever possible. That changes the conversation. Repeated worker injuries become more than occupational hazards. They become signals that the system is under pressure. A system under pressure deserves support. But it also deserves the same curiosity that transformed patient safety over the past several decades. Instead of adapting to repeated harm, organizations can ask when the situation first became predictably unsafe, not when the injury finally occurred. That shift doesn't blame patients. It doesn't blame staff. And it doesn't blame leaders working within difficult circumstances. It asks a different question. If we redesign systems to reduce predictable patient harm, why wouldn't we apply the same thinking to healthcare workers? The greatest risk isn't workplace violence alone. It's allowing repeated exposure to become accepted simply because solutions aren't immediate. The phrase, "that's just how it is," should never mark the end of the conversation. It should be the beginning of a better one. Healthcare changed patient safety by refusing to accept predictable harm. Perhaps it's time to apply that same commitment to the people delivering the care.